Okay, 3 adults and 1 child. It's the best I could do, sorry y'all. Okay. Alright, my name is Heather Sunday. Looking at me, you would never guess that I suffered from a chronic illness. It's called an invisible illness, and it can be debilitating and cause excruciating pain. I've lived with this illness for 21 years now, and it's just become my new normal. I don't even remember what it's like to not live in pain. I have fibromyalgia, and roughly 2% of the population, which is about 4 million people, also have it, which is what I found on the CDC's website. And I'd love to give you some information about it. It is a chronic, widespread pain disorder that causes pain all over your body, but it's more than just pain. It has other symptoms also. It causes insomnia, which actually it's very hard to sleep when you have that. You have to find like something to help you sleep, a good routine. And then depression and anxiety. When you don't feel good every day, it makes it really hard not to be depressed. Stiffness in your joints and muscles, and every morning when I wake up, it takes me a little while to get moving. And then cognitive issues, which like when I'm trying to think of a word, sometimes I can't bring the word, even though I know what it is. I can't bring it to my mind and say it, which also lends to the depression because it makes you feel not very smart sometimes and makes social situations really hard. TMJ, which is just pain in your jaw. And then fatigue and tiredness. I also have chronic fatigue syndrome that goes with it, which, plays into the insomnia. So even though I'm really tired, I can't actually sleep at night without help. So it's just a horrible, vicious cycle. And then chronic migraines, a lot of people suffer with those. And luckily right now I'm not suffering with that. But you also can get other rheumatic diseases because fibromyalgia is a rheumatic disease, like lupus and rheumatoid arthritis and Sjogren's syndrome, which I have Sjogren's syndrome, and tingling and numbness in your hands and feet, especially like with changes in temperature. And then IBS, which, is just irritable bowel syndrome, but you can have like painful bladder and stuff. It's not fun. And the cause of fibromyalgia is unknown. They believe it's genetic because my grandmother has it on my mom's side and also my sister. So, and then age can be a factor as well. Like usually middle-aged people get it, and it also affects more women than men. Illness and injury, like if you were really sick sometimes that could bring it on, or if you had like a car accident and you're hurt, then that could also bring it out. And then also lupus and rheumatoid arthritis, if you have those, that can cause you to have fibromyalgia. And stress also plays a huge role. And then also they think maybe obesity can bring it out in some people. Diagnosing fibromyalgia can also be really tricky and time consuming for some people. I was fortunate and got diagnosed in 6 months, but for some people it can take up to a decade because they have to rule out all other possibilities through blood tests, MRIs, you name it, they go through it. And then also they just go over a family history, your patient history, and it takes a long time sometimes. So treatment for fibromyalgia can be simple or it can be difficult for some people. Some people react really well to exercise and diet changes, and then others, they need lots of medications, stress management, cognitive behavioral therapy. But the main thing that I have found that helps is family support. If you have a really good support system, then that helps you a lot. It helps you feel better. It's also important not to isolate yourself when you have a chronic illness, especially fibromyalgia. But fibromyalgia can be debilitating and lead to permanent disability, which I actually am considered disabled. But you also can manage it and live a normal life, and it just depends on each person. If you have fibromyalgia, you're at a higher risk of being hospitalized, you have a lower immune system, a lower quality of life sometimes, and then higher depression rates. And but the best way I have found is just by being supportive from family. All right, and sorry, I'm a little sick, so I keep clearing my throat.
Okay, you
All right, and thank you.
Good job.
All right, here they are.
Around, Travis.
Okay, and there's my little heathen.